Hello, I'm Cassie Destino. I am the founder of IVF Support UAE, and I am so honored to have been asked by Orchid to host today's webinar about fertility and nutrition. So many times when I'm talking to women about what they can do to improve their fertility outcomes, the answer is so often nutrition. And it can feel really overwhelming to know where to start. So today we're going to be talking with two amazing staff members here at Orchid to learn about nutrition and to learn about how it affects our bodies and our fertility treatment. To help us unpack this, I am joined by two guests from the Orchid team, Dr. Serge Mattar, who is a fertility specialist, and clinical dietitian, Sara Abdelghany, who together are going to guide us through science and the everyday strategies of nutrition and fertility. In your clinical experience, how much of a role does proper nutrition really make?
Thank you so much, Cassie. You mentioned a very interesting word. Small change can do a big difference. And here comes the role of nutrition, particularly the small nutrients, the micronutrients. And that's why I would like to understand from Sara today about the particular role of these micronutrients on egg quality. And us as IVF doctors, not only we care about quality, we care also about egg number. So on egg in general, egg health in general, what micronutrients do you usually focus on?
There is a set of micronutrients that are special for males and special for females. I have to say that when we talk about fertility, unfortunately, we're only focusing on females, where sometimes we forget that there is a male factor and we need to take care of the sperm as much as we take care of the egg quality. So to start with, for the sperm quality, zinc is a super important micronutrient.
Yes,
it's major micronutrient that we need to look at. And I always say we need to test and not guess. But if we want to look at natural sources of zinc, they are found in seafood and they are found in sunflower seeds. And they are the building blocks. Without zinc, we cannot make testosterone, and it's also very important for the sperm quality. So zinc is a major one. Omega-3 is another one. It's anti-inflammatory, and it's also important for the sperm cell integrity. It's super important. We are also
the two that you mentioned so far, zinc and omega-3, are both abundant in fish. They are mentioned in fish.
Exactly.
So I think this is the first a key message. If we can focus on fish in our dietary habits, without overdoing it, because there is the risk of mercury intoxication at some point. So I think if we limit our fish intake to 2-3 servings per week, that would be fantastic, whether for us men or even for women.
Exactly. And the types of fish that are not high in heavy metals, they are the small type of fish. Like the sardines are super high in omega-3 and in zinc as well. Salmon, mackerel. Try to avoid big fish because this is where the mercury gets stored. So yes, 2 to 3 times per week fish is super important. But I have to say that if we are preparing for IVF, we sometimes have to supplement a little bit.
Agree. So we always supplement these men with some additional antioxidants. We do not only rely on dietary intake. To be honest with you, it's not recommended to supplement everyone. We supplement men who have abnormalities in the sperm, and not only in the sperm, because historically we used to only test for a semen analysis. And the semen analysis only looks at the external factors of the sperm, what we see with our naked eye, which are the count of the sperm, how many sperm you have, the motility, how fast they swim, and the morphology, how do they look under the microscope. That's not enough. Like some people are pretty on the outside, ugly on the inside. Same for the sperm. The sperm can look totally normal, but the sperm DNA fragmentation, which is the stability of the genetic material of the sperm, could be abnormal. And hence the importance to consider testing for sperm DNA fragmentation anytime you have suspicion like obesity or certain environmental exposure to toxins or chemicals, uncontrolled medical conditions, history of smoking, of excessive alcohol intake. So these people could have a totally normal semen analysis, but an increase in sperm DNA fragmentation. And these are particularly the people who would benefit from extra supplementation of these antioxidants.
Yes, and speaking of DNA, it comes now very important when we're speaking about DNA synthesis is the folate, even for men.
Totally agree. Totally agree. And now this is a new habit that I started. In addition to prescribing the antioxidant, I'm giving them methylfolate. There are so much growing evidence about the role of folate.
Exactly.
in
And
men.
we can add to the list as well vitamin C, a major antioxidant, because usually the sperm are very sensitive to oxidative stress. So vitamin C, vitamin E as well. and selenium.
Yeah.
And one thing here is that the selenium and the vitamin E and the vitamin C, they work synergistically great together. So that's why the food, that's why the food is super important. Because, for example, if you are eating seeds or Brazil nuts, we can get vitamin E and vitamin and selenium, and then we can add to that a fruit like a kiwi, and this is where we are getting the synergistic effect of the food. And this is why we always say food first. Yes, supplements, they do have a space, and they are very important, specifically pre-IVF cycles, but the food is still our concern.
But never over supplementation.
Definitely.
Yeah, because we receive lots of patients taking one from each. They think that if they overdo it, this is better. Not at all. Actually, the peak effect, or let me say the peak beneficial effect, is at a certain concentration. Less than that is not enough. More than that can be harmful.
Definitely.
So please, this is a very important message to patients, not to take multiple over-the-counter antioxidants without coming back to their healthcare professional and taking their approval.
And we usually set a protocol of supplements, definitely. And we always test and go back. And
so that's what I wanted to ask you. I think that a lot of women do some research and they hear about supplements and they get targeted ads on Instagram about supplements. How does someone know if they need supplements? What kind of questions should we be asking?
Let me make it easy. How does someone know if they need the supplements? Ask their healthcare professional.
And then what are we doing? Are we doing a blood test? How are we knowing?
From my point of view, I do a general assessment of what they are eating. So I would guess from the food intake, is there any deficiency? Are they vegan? Are they vegetarian? So that gives me an idea on where to start testing and what to test for.
Can you talk about the Mediterranean diet and how it's useful during a fertility cycle?
So based on what Sara just mentioned now, that the majority of these beneficial food, like whole grains, vegetables, fish, olive oil, they are an integral part of our Mediterranean diet. And not because we're in this region of the world, we're biased, but there is growing level of evidence supporting that a Mediterranean diet is associated with better fertility, better egg quality, better fertilization outcome, better embryo development.
Lower inflammation.
That's actually the core. That's the core. That's the mechanism that explains why we have better fertility outcome, whether spontaneous conception or an assisted reproductive technology. And there's also another superfood in this region of the world, particularly in the Gulf, dates. Here, people in the Gulf, they eat lots of dates. Is it really fertility friendly? What do you think, Sara?
It depends on how, the quantity, and why. Because at the end of the day, one very important thing that we need to look at when I am assessing a fertility diet is blood sugar balance. So those who are eating 10, 12 dates, their sugar is very high, their blood glucose is very high, and this can disrupt the hormones, can spike other hormones, can cortisol. So
what about the quantity of antioxidants in dates? Is it significant or?
I would always say I cannot be biased to one fruit rather than the other, and I always say that the variety is super important because what you find in dates you don't find in kiwi, what you find in kiwi you don't find in oranges and berries. So I cannot only focus on one type. Variety is super important. Different colors is why we ask for variety, because we want many nutrients, many vitamins, coenzymes, etc. So to answer you back, yes, dates have a place, but not with exaggeration and with a variety as well, taking into consideration what are other fruits and vegetables that would complement your diet as well.
Okay. I have a curious question myself. Dates come from palm tree. Do they contain palm oil, which is always portrayed as the evil? No, they don't contain palm oil.
No, definitely not.
So palm oil is limited to my chocolate hazelnut spread, to which I'm addicted, right? Unfortunately. Okay.
Can we talk about protein? Protein is such a hot button issue. Everyone's trying to get more protein in their diet. There's a real fad right now with protein supplements. What is the role of protein in fertility? And is there such a thing as too much protein?
Now, I leave Sara to answer the too much protein, but from my side, my main concern is the protein supplements. Like a recent study showed that 70% of the most famous and trusted brands on the market have contamination with toxic levels of heavy metals like lead and cadmium. And these lead and cadmium can cause inflammation in the testicles, in the ovaries, and you can imagine the rest. So this is my main concern. These people taking these supplements in an uneducated way, just based on their gym coach recommendation or some online
Or
influence?
just simply because they don't want to eat their proteins. Going back to the protein is the building block of all of our hormones. You cannot have proper production of hormones without proteins and good fats. So again, together they work synergistically. So, but going back to proteins, yes, proteins are a very, very important part of the diets when we're talking about fertility or any hormonal imbalances. I do see in the clinic that many of the patients I see are lacking or behind in their proteins towards the end of the day. I'm not talking about vegans or vegetarians now, I'm just talking the general.
Yeah.
And this is what I focus on. Without proteins, you cannot control your blood glucose levels again. So those who don't eat enough proteins, they end up hungry and they end up snacking all day long. And this is where their blood glucose gets disrupted. They end up with insulin resistance. We know the polycystic ovaries and how it affects fertility as well. So proteins are very important. I would always encourage around 1.2 to 1.5 gram per kilogram. But again, this is like a calculation that not everyone can do it. And because like sometimes they just calculate it, they calculate the content rather than the actual proteins. I like to teach my patients what is the portion that is right for you. So this is where in the clinic we teach
do
them
the exercise
portions,
together.
yes, exactly, and how to meet your proteins at every single meal. This is super important.
My question is, does the source of the protein matter? Like if I take my proteins from dairy products rather than from red meat, for example, because infertility, I know infertility, I don't know in general, I know my field. Infertility, some suggest that taking the majority of your protein from dairy products could be associated with lower egg count, lower outcomes in assisted reproductive technology treatment, like lower egg yield, lower fertilization rate, lower embryo development. So I would like to take your input on that.
Yes, so dairy could be a reason for inflammation, because sometimes at the level of the gut, if you have difficulty digesting dairy or you are sensitive to dairy, the inflammation starts there. So every inflammation starts at the level of the gut. So if at the level of the gut I have inflammation, the immune system is compromised. And this is where inflammation starts to spread throughout the body. So in some cases, yes, we have to lower dairy. We have to sometimes lower
Sara, how
gluten.
can I know? I drink milk, I eat cheese, they don't cause me any symptoms. How do I know if I have this sensitivity to dairy or this inflammation at the level of my
I would
gut?
first ask if there's any autoimmune disease.
Okay.
So this is number one. Sometimes I would have to do a food intolerance test. Not to say that everything you find on the food intolerance test is something to be eliminated, but it can give me an insight about what is the level of the leaky gut, how your gut is leaking.
I will stop you there.
Yeah.
I'm not a big fan of this word. I know this word leaky gut now is gaining popularity, but gastroenterologists do not necessarily believe in it. So leaky gut is, the easiest way to explain it is when the gut barrier becomes kind of porous, allowing unwanted materials or toxins to enter our body instead of being expelled in the stools.
Exactly.
But till now, we could not really medically describe it.
Actually, no, it is. Again, I can assess from different things. I can assess if there's a mucus in the stools or not. We can ask for a stool test. We can do an extensive stool test, which is the GI map, where I can check for secretory IgAs. But there are signs and symptoms from the patient that I can tell from bloating, etc., whether we have an intolerance or not. Okay. The major thing is that if I have an autoimmune disease and I know that dairy and gluten can be triggers, I would lower them, especially if I'm going into an IVF cycles. Okay. 3 months at least before the IVF. This is where I would rest the body from any possible triggers. Add to that is that it doesn't have to be dairy or gluten. Sometimes people react to a certain food, they have allergic reaction to certain food. We wouldn't want to overload the body with
any inflammatory trigger or whatever you want.
So this is why we always go into anti-inflammatory diet. Whatever triggers the inflammation, we need to crowd it out from the diet and replace it by anti-inflammatory. Okay. So this is to answer you on dairy.
Is that enough, or probably I would need to strengthen the barriers at the level of my gut by increasing the colonies of the good bacteria, like taking probiotics? So
yes, that is actually the core. But I don't like to start with probiotics. I like to start with what you are eating.
With the root cause.
Yeah, exactly. So, but again, what are you eating? What are you feeding your bacteria? Because if you keep taking the probiotics, but you're not eating the fibers from the fruits and the vegetables, you cannot grow naturally bacteria
Okay.
and good bacteria. And by the way, we don't focus only with fertility on the gut microbiome. There is the uterine microbiome and there's the vaginal microbiome.
This is now very growing interest in the entire microbiome of the body, vagina, uterus, and all of this.
Exactly. So we have to always focus in the diet on prebiotics, fibers to feed the bacteria, fermented foods such as kefir, kimchi,
is yogurt
fermented
enough?
yogurt, So the fermented vegetables, they are very high in prebiotics that would feed the good bacteria, but also
this question is for me actually. If I get enough of these fermented food from my diet, would I still need to take probiotics?
Not necessarily.
I agree.
Especially if I have irregular bowel movements.
I agree because even the association of prebiotics with improvement in fertility, I always go back to fertility. It showed that there is no strong evidence to support its use to improve outcomes.
Exactly. I don't like probiotics randomly be taken, especially if you have SIBO. And sometimes so many patients, they have SIBO, they take the probiotics, it makes more bloating, it makes them feel more bloated. So it doesn't solve the issue here. Yeah. That's why I always focus on the root cause, going back to the diet.
Hippocrates said all diseases start in the gut.
I do agree.
He was right.
I do agree. Yeah. And that's why I told you, every inflammatory disease starts from the gut.
So you are Hippocrates? Are you claiming you're Hippocrates?
Another thing that a lot of people talk about in the community of women who are trying to get pregnant is endocrine disruptors. Can you tell us a little about what they are? Can we avoid them? What are they doing to us? What can we do?
As the name suggests, they are endocrine disruptors. They play the role of hormones even though they are not hormones.
What is one? Explain them to me.
What is one? They're present almost everywhere around us, like from plastic containers, water bottles, phthalates, our cosmetics, our shampoo, our deodorant. Name them. Some cooking
dioxin from the receipts.
Yeah. And what are they doing in our bodies?
So they act as they are hormones, eventually disrupting the natural balance and action of the natural hormones in our body. And this is their toxicity.
And they are linked to polycystic ovaries, they are linked to estrogen dominance, they are linked to cancers, breast cancer. And unfortunately, we cannot control 100% the endocrine disruptors, but when we make informative decisions and we start slow,
the basics,
you decrease the load. I mean, at the end of the day, the liver in our body is the detoxification organ. We cannot, we just have to make sure that our liver is healthy and let it do its job.
And there's another thing that could help getting rid of the endocrine disruptors, not only the liver, saunas. Because we can expel them in the sweat. That's interesting.
Yes,
and actually, what's interesting, because now people will think, okay, let me go do sauna. No, start with something easier. Exercise, sweat it out.
Yeah,
that's it.
Sweating, harder way.
Because again, the skin is one of the detoxifications. The kidney is your detoxifications. And that's why drinking enough water and keeping a proper level of hydration.
Well, I wanted to ask about water. What role is hydration playing in all of this? How do we know if we're drinking enough water?
To know if we're drinking enough water, you have to track your urine color. If your urine color, except the first time in the morning, is pale, you're drinking enough. Another formula would be calculating 30 to 35 milliliters per kilogram body weight. But why it's important to stay hydrated? Because if you're not hydrated, you're constipated. And if you're constipated, that can affect as well inflammation and the endocrine detoxification.
Because you're not expelling them.
Exactly. It's super important for our egg quality and sperm motility. Okay, we need enough fluidity and proper blood flow. If you're dehydrated, your blood flow is not flowing properly. Especially in the implementation phase, when we are implementing an embryo, we need a good blood flow and circulation. So if you're dehydrated, your circulation is affected as well.
The funny thing is, Sara focuses with patients on water intake before their IVF treatment. I focus with them on water intake after their egg retrieval.
Yeah.
Every patient, before I discharge her after egg retrieval, please drink enough water, hydrate yourself well. Not any water, I prefer electrolyte water.
Yeah.
Not necessarily these sport drinks from supermarkets. Any salty soup like tomato soup, ramen.
Salt with lemon.
Exactly, and nothing, salt with lemon. Why is that? Because these electrolytes will help her bloating decrease faster by absorbing the fluid that is in her third space to bring it back to the circulation so she can urinate it out.
Yeah.
So the symptoms of the stimulation will resolve faster and her bloating will resolve faster, and eventually the risk of hyperstimulation will decrease. I always discharge my patients, drink water, electrolyte water.
And of course it carries on through pregnancy, through breastfeeding. We need to be drinking tons of
Always,
water.
yeah,
I mean, there's never a time in our lives where we don't need water.
Yeah.
I just want to hit a couple more points before we wrap up. Can you talk about the role of caffeine in the body during IVFs?
Honestly, like I know that most societies recommend up to 200 milligram a day, right,
Just 1 cup
of caffeine, but I do not stick by that. Like if this cup of coffee is what's bringing joy to my patient, I will not be the one telling her to stop it. And there are some studies evaluating caffeine intake in the 1 year prior to fertility treatment, and they showed no association with worse outcomes. Just one small study showed an increased risk of miscarriage or spontaneous abortion, but it was just a small study out of the thousands others done. So
I agree.
Yeah,
I agree, but I always advise before 2 p.m. because we want a good sleep.
Yeah, just for the sleep. Yeah, which is very important for fertility.
But I wouldn't eliminate.
And talking about sleep, melatonin, which is the hormone that regulates our sleep, interestingly enough, it has an antioxidant activity. So melatonin can get rid of the free radicals, which can harm the ovaries. So even some studies were done on melatonin supplementation for IVF patients. Give them between 2 to 6 milligram of melatonin daily, and some had actually shown better egg quality, better egg number, better fertilization, and better embryo development.
Yeah,
that's interesting.
Yeah, I read.
But I mean, if you sleep well, you don't need to be supplemented.
Yeah.
Let's put it this way.
And finally, let's talk about BMI. What is your take on BMI? How important is it? What would you say to a patient with a high BMI?
I don't usually look at the BMI, honestly. I don't look at that.
Thank
It
you.
doesn't give me any indication. I would just look at the muscle mass, the fat mass. We need a healthy weight. At the end of the day, to produce hormones properly, you need a healthy weight. Especially before IVF, I would avoid quick fluctuations in weight, whether it was super gaining or losing quickly. We don't want that because that can disrupt the hormones. And so I would always go for nutrient-dense diet 3 months before the IVF. This is your time to change the environment of your eggs and your sperm. It's very, very important to start working 3 months before your IVF cycle. This is where you see the impact. So the egg today is the reflection of what you ate 3 months before. So if you want a proper maturation in your eggs or a good quality sperm, it reflects 3 months backwards. So please start early looking at your diet, 3 to 6 months if you can. Address your deficiencies early. Try to optimize your levels through diet and maybe supplementations if needed. And the weight at this stage is not my priority.
She touched on body composition. So if we want to put it in a concrete example, like if you take for a man, for example, if let's say his weight is X, but the majority of this X is coming from fat, what will happen is actually a process called aromatization, which is the conversion of his testosterone into the female hormone, into estrogen in the peripheral fat of the body, which eventually will impact sperm production. On the other side, if the majority of this weight X is coming from a muscle mass, his testosterone level will be higher, and eventually his fertility and reproductive outcomes will be better.
Definitely. So that's why I don't look at the BMI. We look at your muscle mass, how much you have muscles, and where is the distribution of your fat. Unfortunately, men do store fat in their belly area, which affects their insulin resistance, their metabolic syndrome, and this is where things go wrong.
Well, thank you both so much for your time today. I learned a lot. And I'm so glad to welcome you aboard here at Orchid.
Thank you. I'm very excited.
Yeah, it's going to be great to have you on the team. And thank you both so much for your time.
Thank you, Cassie. It was amazing.
Thank you.